I'm Matt Willis, Public Health Officer from Marin County with a COVID-19 update for May 12th. Today is a historic day in our pandemic story because today is the first day since the start of the pandemic that we're not operating under any sort of state of emergency at the local, state, federal, or global level. For over 3 years, we were under 4 layers of emergency declarations, and the last was lifted yesterday when the Biden administration ended the National Emergency Declaration. And it happens to be an amazing spring day. So what does this mean for us? First, it's important to remember that those declarations are human decisions, experts getting together, trying to read the signs. And what's most important for us at the local level is what the virus is up to here. Luckily, we have the tools to answer that question. And this week, for the first time in over 6 months, there are fewer than 10 people with COVID in Marin hospitals. And wastewater levels are close to their lowest in a year. Based on these local metrics, last week we shifted from medium to low Marin County COVID level. So there's good alignment between local trends and these national and global declarations. To better describe our pandemic path, and because you indicated in our recent survey that you like to see data, I want to share an important analysis by our amazing epidemiologists. This graph compares wastewater levels and mortality rates in Marin over the past year and a half. The blue line is wastewater levels, and the green line is death rates. And you can see how virus surges generally track with increased deaths, especially in that first big Omicron surge in early 2022. But something else is happening. The number of deaths associated with each virus surge is decreasing. The lines are getting further apart. And this steady uncoupling of mortality and virus levels means one thing primarily, and that is the average severity of illness among those infected continues to decline. Many of us know this from personal experience, and it's reassuring to see it so clearly in our data. The reason for this is mainly immunologic. Almost all of us in Marin have protection from both vaccines and from infections. It's not novel anymore. Our bodies know the virus and can better fight it off. Still, that immunity wears off over time. And those of us who are immunocompromised or above age 65 who haven't gotten the shot in the last 4 months should go ahead and get that updated booster. Most pharmacies and clinics are offering the shot, and you can use Vaccine Finder on our website to find other options. For preventing deaths, the easy availability of treatments like Paxlovid has been another game changer for us. This all raises questions about how the pandemic will end. You may have heard the idea that pandemics start with a bang and end with a whimper, and that's consistent with what we're seeing so far. A long, gradual taper to an endemic state is, in fact, the best case scenario. But it's psychologically hard because it doesn't offer real closure or a clear moment where it's over. Right now, we're in an in-between space between what it was, a global emergency, and what it will become, an endemic and predictable part of our lives. So this phase is unsettling because there's still uncertainty, and we need to keep a close eye on it and be ready to respond. We don't know what that baseline endemic case rate will be, or what the enduring effects of long COVID might be. And there's the wild card of new variants that could fuel another surge. My biggest concerns in terms of public health response is that people are so tired of the pandemic and that it's gotten so politicized that we close down the COVID response shop at the national and state level prematurely. We need to be able to match the threats as they change. For our part in Marin, we have systems to monitor virus levels and mobilize vaccines and treatments, but we'll need federal and state supports. In Marin, I know we've been able to connect the dots between the measures we all took and the lives we all saved together. I don't see full lockdowns ever again, but wearing a mask in certain places, staying up to date with vaccines, and getting treated for infection are simple steps that will get us most of the way if there's a resurgence. So to summarize, as of today, local, state, national, and global governance all agree that we're in a new, better place and the pandemic state of emergency has ended. This coincides with the decline in virus burden in Marin. Our data shows our immunity is paying off in declining mortality rates. Still, the pandemic isn't over, and our most vulnerable residents should get up to date with a bivalent booster. For our community, we've seen what works, and we're fortunate to be in a community that can stay prepared while we celebrate how far we've come. Thank you for doing your part.